I'm a fellowship-trained breast surgical oncologist. I'm Dr. Amani Jambekar. Let's talk about breast cancer recurrences, which occur in a very short amount of time, like months. This is a mammogram showing a patient who had a breast cancer recurrence. This white line on the mammogram is actually a sticker that the mammography techs put on her skin before she got a mammogram, so you could see on the mammogram where her surgical scar was. The white fluffy tissue around her scar marker is pretty normal, and it is what we would expect after someone had had a lumpectomy for breast cancer. And her surgeon left these 4 identical clips to mark where they had been, so that way it could easily be seen on a mammogram as well. This patient has another clip in here which indicates that she had a biopsy of something else in the area, but it was not something that was cancer, and so it didn't need to be removed. What's suspicious about this mammogram are these little calcifications, or these tiny little white dots that you see right in the center of the surgical clips. And here's a zoomed in view of them. Having these calcifications in this location right in the lumpectomy cavity is very suspicious. And if we saw it on anyone's mammogram after they had had a lumpectomy, we would worry that it was the breast cancer coming back. But if we saw it just a few months after having a lumpectomy and radiation, then we would be really concerned that it's not necessarily the breast cancer coming back, but that the breast cancer wasn't completely removed during the lumpectomy. And that can happen a few different ways. Either there could be a positive margin, meaning that the surgeon left a little bit of cancer behind, or there may have been a small focus of cancer very closely associated with whatever calcifications or mass the surgeon removed, but that was separate from it. So when the surgeon cut in between the two, it looked like there was a negative margin, but in reality there wasn't. When breast cancer is back in the same area within a matter of months after surgery, then usually one of those two things has happened. It's not the breast cancer coming back. Breast cancers are rarely that aggressive that they will come back so quickly. This is a different story if someone was recommended to have radiation and they didn't do it, or they didn't take radiation or any kind of systemic treatment. In that case, breast cancer can come back in the breast fairly quickly.